All right, welcome back. So in our last explainer, we talked all about observational studies and how they're great for spotting correlations. But we hit a bit of a wall, didn't we? Correlation is not causation. So how do we make that leap? How do we prove that one thing actually causes another? Well, that's exactly where experimental studies come into play.
This is really the million-dollar question. It's what separates just watching something happen from truly knowing why it happened. Yeah, we can observe that people who eat tons of veggies tend to be healthier. But did the veggies cause the good health, or is something else going on? To prove it one way or the other, we have to stop just watching and start intervening.
And this is a fundamental shift in how we approach the problem. We're moving from passively watching the world to actively doing something. Purposely changing a variable just to see what happens. This is the heart and soul of an experimental study.
And that's the key takeaway right here. When we want to say with confidence that a specific change in diet causes a specific health outcome, experimental studies are, without a doubt, the most powerful tool we've got. So let's start at the top. We're talking about the most rigorous, most controlled type of experiment out there. We're heading into the lab, basically, to see how scientists create the perfect conditions to get a crystal clear answer. This is the randomized controlled trial, or as you'll hear it called all the time, the RCT. It's known as the gold standard for a very good reason. The two magic phrases here are randomly assigned and highly controlled. Randomly assigning people to groups gets rid of a ton of bias, and creating a controlled environment lets us isolate the one thing we're testing. It's all about eliminating as much of the guesswork as possible. And just look at what highly controlled really means. We're talking about a special research facility, really strict criteria for who can even participate, constant monitoring. Heck, the researchers might even provide every single meal and drink. The goal here isn't to mimic real life. It's to create a perfect bubble to answer one very specific question. Under these perfect conditions, can this intervention work? This is what scientists call testing for efficacy.
This example makes it super clear. Imagine researchers give two groups the exact same meals for a few weeks. The only difference? One group gets sugary drinks and the other gets plain water. By controlling everything else, any difference in health outcomes has to be because of the drinks. It's powerful stuff for sure, but it's not exactly how any of us live our daily lives, is it?
So, what happens when we take our experiment out of that perfect lab and throw it into the messy, complicated real world? Well, that brings us to our next type of study.
And this is called a pragmatic trial. The name says it all. It's pragmatic. It's practical. Instead of asking if something can work in a perfect vacuum, it asks if it works out here, in the middle of all the chaos of everyday life. And you can immediately see the differences. This is done in a regular doctor's office with typical patients. The researchers have very little control. The intervention might just be a 2-minute conversation. A pragmatic trial isn't testing for efficacy, that can it work question. It's testing for effectiveness. In other words, in the real world, does it actually work?
Let's use our same example. Here, a doctor might just say, hey, maybe try swapping those sugary drinks for water. Then the patient goes home, back to their job, their stress, their cravings, the vending machine down the hall. This is a true test of whether simple advice can actually stick and make a difference when real life gets in the way.
This little table sums it all up perfectly. An RCT asks, can it work in a controlled bubble? A pragmatic trial asks, does it work out in the wild? Both of these are incredibly valuable, but you gotta know that they're answering two fundamentally different questions.
Okay, so we've got these amazing, powerful study designs. But, and this is a really important but, even a perfect study with 1,000 people doesn't automatically tell you what's going to happen to you. And here's why. Every single one of us is unique. Our genetics, our metabolism, our whole life history is different. What works like a miracle for the average person in a study might do absolutely nothing for you. It could even have a negative effect. So what that means is the ultimate test is an experiment of one, you. Now, I have to be crystal clear about this. This is not a free pass to go try a bunch of crazy, untested things. This should only be done if an intervention is already proven to be safe and always with a doctor or other health professional monitoring you. Your safety is absolutely non-negotiable.
Now for the second big catch we need to talk about. We've looked at the science, but we also have to look at the scientists and the systems they work in, and that means we need to talk about bias.
This is the ideal, right? This is the promise of the scientific method. Scientists are trained to be objective, to let the data do the talking, and to report their findings honestly, no matter what those findings are.
Unfortunately, the real world can be a lot more complicated. When the company that sells the product is also paying for the research on that product, well, it can create a powerful, maybe even unconscious pressure to find a positive result. This doesn't mean the scientists are dishonest, but the system itself can have bias baked right into it.
But here's the good news. Science has a built-in defense for this. Good, reputable journals require researchers to state who they work for and who paid for the research. This transparency is your tool. It doesn't mean a study is automatically bad, but it gives you the context you need to look at the findings with a critical eye.
So, we have covered a lot of ground today. We've gone from the perfect lab to the messy real world, from huge groups to the individual, and from pure objectivity to the influence of bias. Let's put it all together into a toolkit that you can start using right away.
This right here is your new critical lens. The next time you see a health headline, run it through these questions. What kind of study was it, an RCT or Pragmatic? Was it testing if it can work or if it does work? Do these results even apply to me? And finally, who paid for it?
Thinking this way changes everything. You stop being a passive consumer of headlines, and you become an active, critical thinker. It gives you the power to look past the hype and really understand what the science is telling you. So I'll leave you with this. The next time you see that big health claim, what's the first thing you're going to look for?